So great job pooping. I'm proud of you. You do you, a little poo, and then we have a baby. Hello, all of my beautiful birthing people. I'm so excited that you are joining me here today because I'm gonna do part 2 of one of my favorite things, which is meme reaction video. So over on my Instagram a few days ago, I asked you guys to send me memes, and P.S. if you don't follow me on Instagram and you want to see me post occasionally, because I'm really bad at Instagram and I don't really understand how to use it, but it's fun and we chat a little bit, go follow me over there. It's Nurse Save. I'm Nurse Save everywhere, but I'm only on Instagram and YouTube because I don't understand Twitter. I like it. I don't get it. I love TikTok, but I don't know how to make them. This is a tangent. I'm sorry. Anyway, I asked you guys to send me some memes and I got a ton of really great submissions. I'm gonna talk about some of them today. We're gonna laugh and we're gonna do some learning together, which are kind of my 2 favorite things. Some of you guys also sent me some reels and some TikToks, which I love, but I think that warrants its own separate video. There is a whole labor and delivery side of TikTok that I think would be really fun to explore with you guys, so we'll definitely be doing that. But without further ado, let's go ahead and get started. So I saved them all on my phone, so I'll be looking there for the meme, but I'm obviously going to insert it so that you guys can see too. Little picture in a picture. I'm going to scoot over. Let's go this way. I kind of like that I look like an ethereal being with the light behind me. Okay, so this one, gold. It is a dude who literally sees anything and wonders, is this a symptom of labor? I cannot tell you how many times when either trying to get pregnant or towards the end of pregnancy, I go on Dr. Google to Google, is this a symptom of early pregnancy? Is this a symptom of labor? Just wanting to know, right? Because we don't want to miss anything. Here's my advice for you. It's really easy to get caught up in all of those things, right? It's really easy to get caught up in early labor when you start having contractions that are timeable and so exciting, but we have to focus on our long-term goal. You are not going to miss labor, that I can assure you of, but if we focus on literally anything that could possibly be a sign of labor, we will become exhausted, right? Because we're staying awake and timing our contractions even though, you know, they're an hour apart, or we'll be up and walking in the middle of the night. In early labor, my recommendation for just about everybody is to continue on with your normal life as much as possible. So if it's in the middle of the night, sleep. If it's during the day, get up and be moving around, and you can be doing your walks and doing your squats and doing your miles circuit, but you're still kind of going along with your normal day. If it is labor, things are going to build up and get more intense until eventually you're like, well, I cannot continue with my normal day. I would recommend avoiding Dr. Google. If you have a question, if you have a concern, please, please, please call your doctor, speak with a nurse, go into triage if you need to be seen. So it's really obviously exciting, right? We want our babies to come. But if you're focusing on every little twinge and every little feeling, you might end up being more exhausted by the time true active labor comes around. Oh, I love this one too. This actually goes along with that last one, and I didn't save them in any order, but this is perfect. It's a picture of Dwight, and it says, your baby is due by 40 weeks. False, the 40-week due date is not evidence-based. 50% of first-time moms will give birth more than 5 days past their due date. And that's right. We know that really when we're talking about our due date, what we should do in our minds is we should take that day that they give us, May 31st, and we'll go 2 weeks before and 2 weeks after and give ourselves a full month in which we could expect ourselves to give birth. Only about 5% of women give birth on their due date, and most first-time mothers without medical intervention will go to 41 and 3 weeks gestation. And it's really important. I always in my head, I was like, okay, my due date is 42 weeks. I know I will have my baby around 42 weeks, if not before that. So that I didn't put this 40-week thing in my head and then get so frustrated when I went past it. I know it's normal to be frustrated, and it's normal to be overwhelmed by the fact that you feel like a beached whale. You're a beautiful beached whale, but a beached whale, and you're just done with being pregnant. Remember that at the end of your pregnancy, your baby is doing a lot of really important things to practice for the outside world. They're practicing sucking, getting ready to breastfeed. They are practicing breathing to get ready to breathe on the outside. All of these things are really important, and your body is going to decide the correct time for your baby. Now, if there is a need for medical intervention earlier, definitely great. But just because you've hit 40 weeks does not mean that you necessarily need to be induced. That needs to be a conversation that you have with your doctor, and it is okay to go past your due date. Okay, here's a funny one, a dad joke for you. His first dad joke, I love it. So it's a dude, he's calling the hospital, he says, my wife's going into labor, what should I do? And the nurse says, is this her first child? And he said, no, this is her husband, you're speaking to her husband. That is gold, and I'm sure one of many dad jokes to come from him. I applaud him. I love a good dad joke. I love a good dad joke. But here's what I want to say about that. I understand your partner feels like they want to do something, they want to call the provider. But often in this case, it's really great to either be on speakerphone or let the person who's in labor speak to the provider, because we can gauge, not 100% accurate, not all the time, you know your body better than any provider. We can sort of sometimes gauge where you are in the labor progress by actually speaking with you and speaking with you through a contraction, hearing how you're breathing through the contraction, if you're able to continue to talk through the contraction, how you're working through things. So it is always a great idea, if you're able to, for the person who's actually having the labor contractions to call the provider. And if you are too far into labor to do that, that's okay, but maybe being on speakerphone at some point, or don't be surprised if the provider asks your partner to speak to you. That's not uncommon, because midwives, OBs, and nurses, we understand for the most part, and again, everybody's different, but we understand the generalized songs of labor that we hear, and so sometimes speaking with you can be a really good indicator for us to tell you to come into the hospital or to continue to labor at home if that's what you want to do. Okay, this one I love because I love this guy's face. I love this meme in general, but I also get this question all the time, y'all. Like in my DMs, people are sliding on in and asking me this. I know that kind of means something sexual, but I'm not using it in that way. Okay. Me at 36 weeks, I shaved in case I go into labor early, my vagina. It's a dude with a mullet making a goofy face. Here's the thing about pubic hair. Do whatever in the whole wide world makes you comfortable. Do whatever you want with your pubic hair. Your providers do not care what is happening in that region at all, as far as pubic hair goes. Now, something to keep in mind. A few different things, actually. One, when you have a grossly pregnant belly, grossly but beautiful pregnant belly, I should say, right? Sometimes it's hard to visualize that area. We also know that we have extra blood flow to that area, sometimes a little bit of swelling, sometimes we have some varicosities, so you really need to be quite careful if you are shaving yourself. An electric razor where it would be more difficult to cut yourself is what I would recommend. Getting a mirror to kind of take a peek and see what you're doing, not doing it blind. Okay, you don't want to look like that dude, unless that's what you're going for, and that's fine. I have had patients before tell me, oh, I let my partner shave me. I love that you have that close relationship with your partner. I think that's beautiful. I would not let my husband come near me with a razor for my own safety and well-being, but you do you. Getting waxed is also an option if that's something that you would like to do. You can take some Tylenol beforehand if your doctor okays that, because again, things are going to be perhaps a little bit more sensitive with that extra blood flow, swelling, varicosities that can occur. Doing nothing, absolutely nothing, and letting your hair grow the way that nature, the Lord, whoever intended, is totally fine too. Something that is important to understand is if for some reason you are needing a cesarean birth for the safety of you, the safety of your baby, whatever reason, there will more than likely be some shaving that occurs right at that bikini line area so that we have a nice clean area in which to do a incision for a cesarean birth, and also so that we don't have a big dressing stuck to that area. So if that's something that you maybe want to shave beforehand because you'd be uncomfortable with a nurse shaving that, that's totally fine. From my experience, most of the time we are doing so many other things, it's not a big issue. But just kind of something to keep in mind. I just have a lot of thoughts and feelings on this. I just want everybody to feel good and not feel like, oh, if I don't shave, my nurse or my doctor is going to be talking about my pubic hair. Because we don't care. And we want you to do what makes you feel comfortable, what makes you feel good, what makes you feel secure. It doesn't affect our job at all. So, do with that what you will. Going from that, this is one of my favorite memes and favorite little video. So this one is that one of the little girl patting her dog on the butt and says, "Great job pooping." And it says, explaining to the patient that if she poops, she's pushing right. So yeah, pushing is weird because when you're fully dilated, you literally feel like you're about to poop everywhere because your baby's head is down in your pelvic floor. It's pressing on those same nerves and basically on your colon. And so when you're pushing, a lot of times if there is some stool, and there's often not much, but if there's a little bit of stool, it's gonna come out when you're pushing. Here's the thing, that is okay. You're gonna feel like you're pooping yourself whether you do it or not, particularly if you don't have an epidural. I literally was like, oh my gosh, I'm pooping everywhere. And I didn't the first time, but I definitely did the second time because nobody said anything. I still see my coworkers every day and I look them in the eye. It does not affect me at all because I know that it's normal. I know that we wipe it away. We don't worry about it. It's nothing for you to be embarrassed about. I often have the conversation in labor when we talk about pushing that a lot of times we are pushing in the same way that we push to have a bowel movement. Labor and pushing are this weird combination of relaxing your pelvic floor, which can be really hard to do. When we experience pain, our natural inclination is to tense up against it. But by relaxing your pelvic floor, you're gonna let your baby descend into the birth canal. And then by also relaxing your pelvic floor while you're pushing, you're gonna allow your baby to come through the birth canal. So great ways that we can kind of help you push if you're having trouble tapping into that. If you don't have an epidural, I love a little bit of pushing on the toilet. Obviously, we don't want to deliver the baby in the toilet, but if we've got a little bit of time, the toilet is a great place to push. It's also a great place to labor. I love the bathroom because you can shut the door, you can turn the lights down, you can be in your own little zen space. It feels private, it feels secure. The toilet is a great place to labor because it allows us to relax our pelvic floor. So I'm all about the toilet. We also have the option at some hospitals for like a birthing stool, something like that, that kind of supports us in a way that's almost like sitting on the toilet. So these are all options. But if you poop, it's okay. And if you are like, please tell me if I poop, I need to know, I will tell you. But normally I'm gonna wipe it away and I'm not gonna mention it. I'm not gonna say a thing about it. And then if you ask me, I might be intentionally vague about it, just depending on what you've told me about how you're feeling. Because I never want you to feel uncomfortable with anything that your body's doing during labor. Your body knows what to do. This is just a natural part of giving birth. And it might not be the most glamorous part of giving birth, but it is the most powerful part of giving birth because you are literally bringing your child into the world and it is a beautiful thing. So, great job pooping. I'm proud of you. You do you, a little poo, and then we have a baby. Okay, so this one is a dude trying to like push water off of the beach as the waves keep rolling in, and it says patient who wants their pad changed after every contraction after they SROM, which is spontaneous rupture of membranes. Speaking of SROM or AROM or anything, when your water breaks, and I know I've talked about this before, but I'm going to talk about it again because it's really important to understand, your baby is continually making more fluid. Amniotic fluid is baby pee. And other stuff, but mostly baby pee. It's sterile, don't worry. But your baby's continually making more. So when we break our bag of water, whether it is artificially again or spontaneously, we're gonna have a little gush of fluid. Sometimes it's big and sometimes it's very small, depending on where the baby's head is and where the break in the bag of water is. But then it's almost like you have a wine bottle and you were really desperate for wine. It has been a night. So you don't have a wine bottle opener, you don't have a corkscrew. So you end up pushing the cork into the bottle of wine. When you hold the bottle like this, the cork will sit right there at the opening and block the wine from coming out. But as you kind of tilt it from one side or the other, or if you have any force on that wine bottle, more fluid is going to escape around that cork. The cork in this instance is your baby's head, and the extra fluid is the amniotic fluid. So often when we have a big contraction or baby shifts their head a little bit, we have some rotation, descent, and dilation, we're gonna have another big gush of fluid. And that's really normal. I have had people be fine with just a small pad in their underwear. I have had people, I went and got them an adult diaper because there was so much fluid pouring out of them. But you're going to continue to see fluid until the birth of your baby. Now, if this grosses you out, if this is not a thing that you enjoy, we definitely can change your pad continuously to make you feel good, to make you feel comfortable. That's really important, right? But some other things maybe we can consider is, I'm gonna say it again, sitting on the toilet without our underwear on to let that fluid come out, and that way you don't feel so ishy and gushy. Getting in the tub can be an option that we can do so that you're not feeling that continual leakage of fluid. But again, we can continue to change your pad just with the understanding that it's kind of like trying to sweep away the water off of a beach. The tides are gonna keep rolling, and that's okay and that's normal. And you're gonna notice after your baby's born, there's gonna be a giant gush of fluid too, because there was a lot of fluid back up behind your baby. Okay, this is my last one. And it is a woman who has very clearly just given birth. She looks fabulous, beautiful, but she does have on some of the telltale mesh underwear, and she does have a hospital bracelet on. So she's pretty freshly postpartum, I would say, within the last 48 hours. And it says, when your doctor clears you for postpartum sex, but you're still wearing a diaper. So this is funny, this is comical, but it also, here's my thing. There are a lot of memes, there are a lot of funny things like, oh, wine and panty liners because I wet myself when I jump around. Things that glorify and normalize things that are maybe common to happen after birth, but are not normal. So your OB is not going to clear you for postpartum sex until probably 6 weeks postpartum. You should not be wearing a diaper at 6 weeks postpartum. Your bleeding should have stopped. If it hasn't stopped, there will be follow-up. We need to examine why we're still bleeding. If you're still bleeding at your follow-up, then we might need to consider, is there an issue with retained placenta or a retained piece of membrane, a retained product of conception, okay? There's something that's making you still bleed that we need to explore. You shouldn't be wearing a diaper because you're peeing yourself either, okay? Not being able to hold in your urine after having a baby, whether it's when you run, sneeze, exercise, laugh really hard, jump on the trampoline, are all things that are quite common, but they're not normal. And when we normalize those things, then we have a little bit of an issue because we tell women that it's fine. And it's not, because we can solve these problems. I just did an amazing video. I'm going to give another plug to her because I love her, with Dr. Michelle Little of Women in Motion Wellness. I will link her Instagram. I will link the video all about postpartum sex and what is actually normal and what might be common, but we need to seek assistance with the pelvic floor PT. And if you're still wearing a diaper because you're peeing yourself, you need to go see a pelvic floor PT stat. So if you go to your 6-week follow-up appointment and you get cleared for sex, for penetrative sex, and you're not wearing a diaper, right? Because we know that that's not normal, but you're exhausted. Your hormones are kind of all over the place. You are having breast milk leaking out all the time. You are waking up 5 times a night to nurse. You are not feeling like you're even taking care of yourself. It is also okay to kind of hold off on that. There are other ways to be intimate with a partner besides penetrative sex. You need to do what feels good and what feels right for you. We talk about all of this in that video, so definitely go check that out if you haven't. So yes, sometimes I feel like we go to our 6-week postpartum appointment and we kind of see it as like, this is my sex appointment, now I get to go have sex. But like, it's okay if you're not ready for that. And it's okay if it doesn't happen for a few more weeks. And it's okay if you're rip-roaring ready and you go straight home and do your thing. But just know that both are normal on the spectrum, and to feel like you're clearing me for this but I'm not ready is a normal feeling. And definitely seek out help if you're feeling like things are not feeling as they should, right? We might have some things that are happening that are common, but they're not normal. So that's my 2 cents on that. Anyway, I want to thank you guys so much for watching. Definitely, if you have any other funny memes that you ever come across, send them to me and I will make sure to make another video like this. I know a lot of this was me ranting. Oh, my child's here. I know a lot of this was me ranting, but I have a lot of thoughts and feelings, and I think it's important that we laugh at things, but then also understand the truth and the education behind them. I have to go deal with this little one. Bye, guys.